Hi, everyone. Welcome to another episode of Dental Talk 360. Today, we have the honor and privilege of having Dr. Michael Abrouk here. He's a cosmetic, Harvard-trained dermatologist practicing in Coral Gables. If you want to tell us a little bit about yourself, Doc.
Yeah, thank you guys very much for the warm welcome over here. I'm Dr. Michael Abrouk, as you mentioned, a dermatologist, fellowship trained back at Harvard and down here in Coral Gables. We focus a lot on cosmetic work, predominantly lasers, injectables, and other interventions that we've kind of pioneered. So let's kick it off.
Awesome.
What got you into cosmetic dermatology? What was your passion?
Well, that's an interesting question. I would actually say the passions are more in technology than anything. And back in undergraduate and some of the graduate studies and everything, my interests were much more in the innovative new devices and technologies. It just turns out that there's this one lab over at Harvard where all of the lasers in the world were invented. So all of the technology that we use, whether it's ophthalmology, whether it's dermatology, whether it's in dentistry and everything in between, they come from some of the lasers we use in medicine. Most of those came from our research lab, which is kind of cool. So it's sort of this beautiful harmony of how can you both create an aesthetic appearance for an individual, but also how can you create new technologies and marrying both of those worlds. So it's a very virtuous cycle on there. So that's where the passions have always been, pushing that frontier.
Very nice. And how long ago did you graduate?
It's been a couple of years now. Yeah. So been practicing for over a decade, but then finished up and joined the team down here in Miami about 4 years ago.
That's awesome.
Yeah.
Nice.
Yeah.
What would you say is your main treatments that you find yourself doing, your most common treatments?
On myself or on patients?
We don't need to know the patient.
I mean, look, you got to practice what you preach to a certain extent. But I would say by far and away, especially in Florida and in many other markets, the biggest request are really laser resurfacing procedures. These are things you can think about it for your audience and just in general, if you've got brown spots on your skin, kind of old looking photo damage, that's sort of when you get liver spots, as they kind of used to call them back in the day. But that's really just sun damage and sun exposure over the years, as well as sort of rosacea, blood vessels, all sorts of things. But by far and away, number one, laser resurfacing.
Okay.
It's kind of like putting a whole new can of paint on your skin and really frames the face, just like putting some great new teeth changes everything.
Yep.
Whitening things, replacing things, veneers, I'll let you guys talk about that. But you can think about it almost in analogy on what we do from a skin resurfacing standpoint.
Very nice.
And what's the healing process or the treatment process to do a skin resurfacing?
Well, it's another great question. I think just like you guys, we tailor everything to the individual. Some people don't need a big procedure and other people, well, they might have a lot more advanced age, more wrinkles, fine lines, laxity. So they're going to require a bigger procedure. Downtime can range anywhere from no downtime at all to like bloody for 2 weeks. Mm-hmm. And it really depends on what we individualize to you when you come on in.
Awesome.
You don't have any questions?
No, I don't have any questions. I'm just...
How bloody would I be if I did that?
Well, we'll be gentle, but maybe a little bit bloody.
Yeah. So we met Dr. Brook when we opened up the location here in Miami. And one of the things that we had in common is that we change people's aesthetics. We're always working on rejuvenating a patient. And a lot of people don't know, but like us as dentists, we are what set the lower third of the face. So teeth essentially can change the dimension of your lower third of your face, which give you the support that most people need. So just by changing, when we do the smiles, when we raise bites and do different things, we really affect like the nasolabial folds, we affect the jowls, we affect different things that can make a patient look 10, 15 years younger just by doing one procedure. So when I met him, I was like, I think it's going to be great for our patients to kind of find out how they can stay young. Because nowadays, everybody wants to stay young. They want to stay healthy. They want to look their best for their age. And they just want to look at their prime. So I want to see, like, I want you guys to know the different types of procedures that we can do as dentists, but also the procedures that you can supplement so that when we do a case like this and the patient goes to you, so we can just add on to each other and like mascara say 1 + 1 = 5 in this case. So I think this is something that we should dive into a little bit more. So we can start with the teeth.
Absolutely.
Let's do it.
Yeah.
So as we're expanding the vertical dimension or changing someone's bite, which increases the dimension of their face back to normal, right? Because they've broken down their teeth over time. What you see then is sometimes some stretching of the face. And especially in my older patients, that'll have like the crow's feet and all of that, and they want a resurfacing and a reenhancement. So as an adjunct therapy, I think it really helps to enhance the overall profile, the lips, everything else. So talk to us a little bit about what treatments you would do once that patient is done. Their smile is in a perfect position for then your artistry to come in and put in your touch.
Especially like the nasolabial folds,
It's huge.
the jabs here.
Which are some of the most requested things. And that's where we tackle more with injectables, energy-based devices. But like you guys already said, it's that harmony. You know, you can't have one without the other. And I love the 1 + 1 = 5.
Yeah.
That's fantastic. I mean, mathematically, it doesn't make sense. But in cosmetics, it actually does. Because really, when you have great framework, great scaffolding with the teeth, the dentition, it frames everything. I would say probably the number 2 most requested procedure that we have coming in is jawline augmentation. People that really want to frame that lower third of their face and create that nice, tight, sharp jawline. It's very elegant for female patients and very masculine and powerful for male patients. And you really can't achieve that without addressing the teeth first. It's all part of the same painting. We're just adding different shades of that paint. So dentistry is absolutely paramount to creating a great appearance there. The other thing that we really address there for more female patients, but males as well, is the perioral skin. And that is involving really the lips, the cutaneous lip, the mucosal lip, and creating a nice augmentation there to frame that. So,
And yeah, what people don't realize that with the teeth, so we can give lip support. So somebody that is a little bit in their older years, the fulcrum here gets a little bit elongated as we age. So the lip also gets smaller. So the upper lip, instead of seeing the cupid's bow, it becomes like a line. And then when this patient smile, it tends to be something straight. It drops completely. It's like a curtain that drops down. As we age, it keeps dropping down. And then the teeth, which is the stage, you don't get to see it anymore.
Correct.
So when we place veneers, we are a lot of these times we're adding volume to the face, which gives lip support, and then both on the sides and in the front. And now this patient is able to show more lips.
Yeah.
So in the case, like a lot of people nowadays are going for fillers. I think fillers are an amazing adjunct procedure, but I don't think that somebody that has no lip and then they end up putting all this filler, it creates a lot of weight, and then you get less amount of teeth. So a combination of both, meaning adding the teeth so that you can see a little bit more of the lips, and then you finish it with just a minor touch to them to just make them pop out a little bit more,
Exactly.
and show a little bit more. So that's what we can do as dentists. We can expand, we can make your face look a little bit fuller. So as we age, the fat in the face tends to deplete, and then you end up looking skinnier. So a lot of the times by adding teeth on the side, which is a lot of what we do, expanding the corridor, that's what we call it. So when you smile, this negative space that people have here that it looks very dark, when we bring that out, now the patient just looks like they just gain weight. They look, they have like a fuller face, a fuller smile, which balances out with the rest of the face.
more youthful on there.
Correct.
And you know, it's I like what you said too about framing things with the teeth first. It's almost if you're remodeling a home and the interior of the home is destroyed, there's no structure, there's no support, and you put on a new coat of paint to the outside of the house. Well, that's not really going to accomplish much. So you've kind of got to start with the first principles thinking there and build the house up from the inside, and then you put on the nice coat of paint. Then you add a little bit of the landscaping to the front yard, and so on and so forth. And the same is analogous for the teeth, the lips, and the perioral skin.
Correct.
How have the products, and because I know that you were into innovation, how have things changed in the last decade of your practice? And where do you see things going in the sense of laser therapy or any of your adjunct therapies that you do for filler, augmentation, or even the laser?
Well, we've seen a lot of explosion of technology. Again, most of that came from our lab back at Harvard. And Rox Anderson is like this brilliant scientific inventor. He was one of my fellowship mentors when I was up there and still is lifelong. I would say that in a way, I think we've already hit the golden age of technological innovation in dermatology and in skincare. We're kind of already there. This last 2 decades has been such a boom of new lasers, new tissue microcoring devices, new lifting procedures. we don't really have a whole lot further that we can expound upon there. So I think the future is really more injectables as far as an innovative standpoint. And we use a tremendous amount of filler, neuromodulators and everything. So I think that's more where it's going to head, but also minimally invasive and in-home procedures that patients can do.
Now, I just have a question about the laser treatments, and obviously it's not a one and done. You're good.
Correct.
What is your maintenance or upkeep type of timeline, I guess?
I'm pretty laissez-faire with this philosophy on here. I think that really it's to the individual.
Okay.
We have some patients that come in and they want to look as good as humanly possible, and they want to come in every month for the rest of the year. And I mean, they look damn good at the end of that year. But you're also spending an arm and a leg, and there's a lot of downtime and recovery for that. I would say, generally speaking, if you're able to come in once a year and do a comprehensive treatment with me, you're going to look essentially suspended in time. Mm-hmm. You're going to go the next 10, 15, 20 years and kind of not age. And that's sort of the secret that you see with some of these celebrities and other businessmen and women that we take care of that are in their 60s, 70s, 80s, and they still look like they're in their 50s. Mm-hmm. And it's just a little bit of maintenance. So my recommendation is, depending on your individual goals, if you can make the time once a year for a really comprehensive laser resurfacing, you're going to look fantastic.
Gotcha.
Yeah.
Now, on someone like, let's say myself or Vince, Oscar, Bart, what would that downtime be for someone that goes in for that once a year? What would be your downtime, would you think? I know it depends on the person, but someone that has really good skin.
Well, I approach it the same way I would approach spinal surgery.
Got it.
I want all of my patients to take it very seriously. They are lasers. They can often be misconstrued as something that's not that aggressive of a procedure, but we're taking off layers of skin. I'm lasering deep into your dermis and epidermis. So I like to mentally prepare people. Treat it like this is brain surgery. Mm-hmm. Treat it like it's spinal surgery, and you'll just take better care of that. Now, the reality of it is depending on what we do, that might be like 3 days of downtime, and that's it. So come in on like a Thursday afternoon and then recover Friday, Saturday, Sunday. You're good to rock and roll by Monday, which is kind of what a lot of people love to do. Mm-hmm. I will say though, some of our more seasoned executives, the guys that have been doing this for years and years, they're so used to the recovery. They're so used to the downtime. They just go back into the office in the boardroom, just red, like deal with it. This is my performance enhancement, because in a way, it's about keeping you in peak performance in whatever you do. And the better you look, as we all know, the better you perform, whether it's negotiating a deal, whether it's closing some sort of contract, or whether it's leading a company. And I think that that's where that sort of performance enhancement truly comes into play with your appearance, allowing you to achieve even greater things.
No, and I think that that's something that we get to witness a lot in our office. We do a lot of cosmetic, and we do purely cosmetic dentistry, and we can see the changes in people's just aura around them. It's not just about the teeth, like that's where things start, but it's like, when I post this before and afters, a lot of the time people are like, oh, the after, like the patient looks, they put makeup, they look a little bit, they look significantly better, not just because of the teeth. And what people don't realize, that is not because I told the patient, hey, I'm doing a photo shoot on you, so I want you to come in with all this makeup and stuff. It's that patient feels so much confidence now that they want to take care of themselves differently. So it usually starts as just like, they don't like smiling, they feel self-conscious. And then after this procedure happens, now they're smiling more. They want to go out. They want to start doing all these different treatments. So we send you, we always try to like send patients. They start with us and we send them to you. So it's like finish the round, because now they want to really invest in themselves because of how they feel. And it relates to their career. It relates to everything else.
It's huge. Yeah. I mean, it's psychological. And it's an honor to be part of that, because like you said, we can kind of get to see that firsthand, planting those seeds. And then you see this person's life just flourish. Yeah. They start taking everything with a little bit more pride and a little bit more dedication, and they start going to the gym and they start asking more questions and being more proactive. It's really a beautiful thing and an honor to kind of nudge people in the right direction with some cosmetic work.
And I wanted to, since we spoke about like maintenance and how to take care of this thing, so more for your listeners, We should talk a little bit about like the maintenance and the veneers. That's something that we get a lot of questions. So I want you guys to talk about the time that it takes to do the veneers, the downtime. So let's just kind of do the same thing, just more towards your patient basis, because they're going to be looking at this episode. So
Yeah.
I'll
Well,
let you
I
guys-
think a lot of my patients that come in, they want to do something for their teeth. They just don't know kind of where to start. And everyone's got this weird misconception where you're going to file down your teeth. It's going to be this lifelong process. What happens if one of them chips or cracks? So maybe kind of like break it down from
Let's
there.
do it. Let's do it.
Because I know a lot of people are going to be watching this and they're like, well, maybe I should get veneers, but I've heard all of these things.
Well, the preparation design really depends on the final design that you create, right? And then from there, you normally prepare only as much as needed for the porcelain or your final endpoint. So you always start with the end in mind, right? So that's how you truly do remarkable work that is as ininvasive as possible. I always say if you prep less, it's the best. And that's actually for us, the thinner the veneer gets, the harder the preparation is, because you have to be so detailed in how you do that, right? Because you don't want to
butcher a tooth and
it's easier to prepare a crown and remove as much enamel as possible than to do a perfectly done veneer with the right line angles, with the right corners and the right shaping to make sure that the when the ceramist creates that final veneer, that it has the right profile, right? So
What's the timeline from maybe start to finish?
So it depends on your
Day
way of
zero
practicing.
consultation.
So day zero consultation, you could easily, if you have been trained and skilled enough to do an intraoral mock-up, where you do it with flowable composite, you could create the mock-up right then and there and start preparing the teeth right then, right? It just really depends on how much, if it's a cosmetic case,
Right.
you could get away with that if they want to keep how their teeth used to look, if you're using similar shapes, right? But if someone's teeth are ground down completely, you normally want to do a design, whether it's a wax up or now with the digital space with ExoCAD design. And that could take anywhere between, I don't know, every lab is different. So it could take a week, it could take 2.
Depends on the
It's just-
ceramist.
so I'm gonna, so
we have our in-house lab.
Yeah.
So that we have a lot of patients that if they're traveling in, regardless of what the procedure is going to be, if it's 10 veneers, if it's 14 over 14, you're doing the whole mouth. We can do our initial consult, take records, start the procedure, and our ceramists are making our wax up at the same time.
That's fantastic.
essentially
Right away.
the main thing,
Which is
you
rare though,
mentioned.
by the way.
Yes.
Yeah, no, that's
very
very
few
rare.
places have
Very
that.
lucky to have that
Yeah.
ability to do it.
Yeah.
I think the main thing that we should differentiate is the fact that, first of all, you have to go to somebody that does this for a living. So not every dentist is the same. I just want to say that.
It's the same in dermatology.
Like you don't,
You know?
you don't go do your boob job with your general practitioner. You
But
don't.
unfortunately,
or
that's
general
how most
surgeon
people do it.
So, exactly. So the first thing that we gotta say is like, just because any dentist can do veneers doesn't mean that they're qualified to be doing veneers. Doesn't mean that you should go to that person for your veneers. So your dentist that does your fillings and your regular dentistry most likely is not trained in this field. So we can start there. So when you go to somebody like us, that our office is based on this, that's all we do. We are prepared for this type of cases. So the way that it works for us is we do the initial consult. This initial consult is where you tell me what you want to change, what you don't like about your smile. And then I was so patient. This is a step where I'm going to listen to you and I'm going to put my vision and your input together to create this new vision of what your smile is going to look like. So this gets done, like Vince mentioned and Freddy mentioned, in either a wax up, which is done by hand, or digital dentistry to create this new design. Then you come in for the day of prep, and it's usually a 3 to 4 hour appointment. It's painless. In both of our offices, we always connect the patients. You put them headsets, they're watching a movie.
Hey, you got the nice TVs in there.
Nice TVs.
Nitrous.
You're
It's very
connected
nice.
in nitrous oxide, so you're completely relaxed. You're in an environment where you're not listening to that handpiece, and it's a procedure that should be done quick.
Yeah.
It shouldn't be like a 5-6 hour, because remember, these are people in the chair.
Right.
So you need to be time efficient. So somebody that does this day in and day out, they're very quick at prepping, very quick at getting you to the final result. So that first day when you leave the office, you leave with the temporaries, which is the blueprint to your finals.
Right.
So what we do is we bring them back the very next day and we photograph the patient and we both sit next to each other looking at the case and the TV, and we see the before and the after. And at this stage, we're able to change things if needed. We talk about color. We make sure that the bite is correct. We make sure that the length of the teeth are correct. We make sure that our design fits in perfectly with the facial features of the patient.
Right.
It should be a test drive,
Correct.
essentially, of the finals.
And then after that, it gets sent to fabrication, which the ceramists make the teeth. And usually it's 3 weeks. And the reason why is because we are very busy and we have a lot of cases in it. The ceramists they're always doing cases. But in general, it takes about 4 to 5 days, depending on the case of the ceramist working on your case to finish that case. And
That
then
doesn't include model production.
correct.
Yeah,
That's just that's just a ceramist
set it
sitting,
up.
to set it up. So it takes a while. This is an art that takes a while. So a lot of people go to places where like they get done the same day. The reason being is because they're using a computerized model that sends it to a printer that prints these veneers, and then somebody called a ceramist comes in and just paints a little bit of a glaze
There's
on
no
them,
life to it.
and that's
Yeah.
it. So there's no life to them. It's a block of porcelain. It's dull. You can always tell.
Well, yeah, we see it all the
Correct.
time.
Yeah.
It's the same in dermatology. You see bad work everywhere, and it's unfortunate. It breaks my heart.
Yes.
You as an artist want to just create art. And you start to see people that have gone down a path that becomes more challenging to correct. So I would imagine, much like you guys, or much like us as well, we do a lot of work correcting other people's work.
Yep.
And that becomes quite a challenge because now you're going in and fixing what was an issue, correcting filler, dissolving filler, helping with laser scarring, all sorts of things, and going in and trying to improve that.
Well, you're also not fighting just the bad work, but mentally now you have a
Yep.
patient who doesn't trust
They
anything.
must trust.
The whole process. So you're fighting a psychological battle of like, I know the last guy said the exact same thing as me,
Yeah.
but and you're really I think that's harder than redoing the work. I agree.
Half the battle is the psychology.
And just like he has probably difficulty with the scarring, it's kind of like when we remove something and it's over prepared.
Yep.
Now they need a root canal or there's cavities underneath that in your heart shouldn't have been there, but you have
It was done with the first time.
that game where it's like, okay, I'm going to take care of this without, talking about anybody else.
Sort of that age-old adage, if you think dealing with experts is expensive, wait until you pay for amateurs.
Exactly.
And you're going to end up paying a
That's how it
lot
is.
more and endure a lot more of a headache. So
It's a time investment and a monetary investment as well. So these patients that end up going somewhere else, they end up spending, essentially you're going to spend twice, and you're going to put in all this time that you're going to waste, because now if they have to dissolve, you have to wait a couple of weeks to even be able to start again
Correct.
the procedure. So it's time consuming.
it's like when you're buying a Ferrari and you head to the dealership and it's at MSRP, but then you find a deal that's $100K less over in the aftermarket, but it's got broken engines,
Yeah,
the gaskets are blown, the transmission's gone, and you think it's a deal, but it's far from it.
But it's not. And then the key in this is once we design.
Shout out to the collection. Direct plug for that.
There you
Ferrari.
go.
And then the key is once we create that blueprint, those temporaries, is that you have a lab similar to yours, similar to the ones that Bart and I use, that really know how to duplicate what you created.
Correct.
Right. And there's a photo that is normally a split photo of half and half. That's how you see if they truly took care of your design.
Yeah.
Because that's not only what you as a clinician designed, shaped, made sure that the bite was right, made sure you put a lot of time and effort making sure that was right. And more importantly, that's the one that the patient approved.
Yep.
Right. So now they get the end result that looks like what you created, but now it's beautiful. It has that natural appearance. It has that feldspathic.
And you've seen all of that.
Of course.
You know, I think one of my favorite Picasso quotations of all time has to be, the true becoming of an artist is not the learning how to paint, rather the learning how to see.
Yes.
And
100%.
that is so much more challenging to do than the actual mechanical aspect of it. You have to be able to see what is the issue to that individual, and that's a real challenge.
It is. And I'm glad you brought that up because it segues into my next point. So, when we're taking those photos, something that I pay attention to, that I know you guys, we all pay attention to, is lip form.
Totally.
Skin around the periorbital areas, right? So like I had a patient the other day, for example, that his lip was completely crooked from old filler.
Yep.
And now I have a problem where he's like, I want my teeth lengthened. And I was like, I measured his teeth and they're at a great length because the other side of his smile is fine. And I go, listen, I don't care how good I could be or how good my lab is. You need to take care of this problem first.
Send him on in. We'll hook him up.
Exactly. So these are things that and this is why it's important for our patients to understand that we do this so much that we pay attention to all the nuances, right?
Yep.
Like, are the commissures of the lip off? Is the lower bulge of the fold off? Because like I don't see my lower teeth. Well, your lower lip curls up, right? So that's when you need to see an expert like Dr. Abrouk to help with those factors.
And then, go ahead. No. Finish what you were saying.
Go ahead.
No, what I was saying is that it's what you said. And Vince and I, we teach at the Nova students, the cosmetic. One of the things that I'm always like drilling them on is always like,
No pun intended on the drilling.
I'm always telling them like, you guys should get your mind out of, you have statistics that you got to follow. Like, you have your guidelines, your guidelines. But I always tell them you got to learn how to see. You have to train your eye.
No, but that's facial aesthetics. Though.
Yeah, but it's facial aesthetics, but it's the same. You have,
Cutter.
Correct.
Yeah, exactly. So you have to train your eye first. Once you train your eye and you get to that level, once you start measuring things, you're going to realize that you're there.
Totally.
You're following those guidelines, but you always have to take a look at something. You have to see the end result. And that's the main thing that a lot of injectors, they inject fillers and they inject, I just want to sell syringes. So they just try to put as much as possible. Somebody like you, I'm pretty sure that you're like, okay, you want to get this result and this is what's going to take to get there. And I'm pretty sure that you're not thinking it needs to be 5, 6, 7 syringes. It's just enough so that when you get there and you know it, that sometimes you're just messing around a little bit here, a little bit, and then it's like, boom, I see it. I got there.
I mean, in my day-to-day, I end up saying no far more than I say yes, talking people out of procedures. And Vince has come into the office and seen that. Less is always more. It's more elegant. It's more sophisticated. It's more minimalist. Whether it's veneers, whether it's cosmetic dentistry, or whether it's cosmetic dermatology, you always want that minimalist style approach, something that keeps people kind of guessing. Did they have something done? Did they just look good?
Yes.
What happened here?
And that's the key.
Now, I will say, though, back to your last point, which is a really important one. I think it's kind of dovetailing off of what you said earlier with, we see a lot of places that don't do great work out there. And back to the students over at whatever dental school that we're discussing with them, I think people need to be more honest in medical training that you can't always develop these skills. You can try as much as you want to be the world's best cosmetic X, Y, and Z, but some people have it.
We've had this argument before.
And other people just don't. And I think the more that we're intellectually honest about that, the happier medical trainees will be. Yeah. You have people with this idea that they want to go be this kind of thing.
I'm going to play devil's advocate, though, because if you have a great ceramist, they can save you.
No,
a great team can help you with anything.
So far. That's it.
No, but they can
so far.
We can go back and forth on this now.
when you go to someone like Michael Appa, or if you're playing basketball with Michael Jordan, you can't teach either of those things.
Exactly.
You have that innate skill.
Yes.
And then that has to be built up over decades with a lot of hard work.
Thank you.
There's only so many Michael Jordans and so many Michael Appas and so many Michael Abrooks.
But it's one of those, look, we've been working with Appa for a year now.
He's fantastic.
And our dentistry has changed so much from just 8 months ago.
Yeah, but you guys were handpicked.
Correct.
A bunch.
He knew that you had to see.
Driving home to you, bro.
But still, it's
I know the people that were applying. You can't compare.
You need to have some natural, but that's with
Exactly.
anything.
But Vince, I told you this is
You
like.
need to have some natural.
Dude, all right, we're going back to Aesthetic Vantage next week. I will show you people that are not capable of working at Mike's office and people that are capable. You know this. You'll see level 3s that don't have the hands, they don't have the skill.
I think the other very important credit, though, to any great leader is the ability to pick the next generation.
Exactly.
and-
So that is a
message.
whole skill that transcends that.
Yes.
And that's why you see in sports as well, player coaches start to emerge.
Yes.
I mean, over at the Miami Heat, much respect to Haslam, but Udonis Haslam wasn't doing anything other than mentoring, which is actually one of the most important things.
Yeah.
You get Shaquille O'Neal. I'm a diehard Lakers fan. All the way. Born and raised in Los Angeles. Shaquille, towards the end of his career, he's not there to put up numbers. He's there to mentor younger players and hand pick who's that next project.
Yeah.
So
Yeah, and that's the key, right? Being able to also give back to create the next generations and allowing them to get that vision.
right.
Yes.
Be able to see. Because if not, then you can't. But there are those individuals like a Michael Jordan or it's a Kobe Bryant.
That's right.
I'm going to even
Kobe
take
all
it
the
back
way.
even more. I do interviews for dental school, right? You see the numbers, you see the passion, but if the numbers don't align, the passion doesn't even matter.
Yeah.
Because at that point, it's just like you don't have the caliber to withstand the threshold of what dental school is going to give to you.
Totally.
You're not going to survive that wave. So you can have the most passion in the world, but if you don't have that IQ, that's it.
You got to have the whole package.
Exactly.
Yeah.
So, Dr. Brook, I see this incredible product here, sun powder,
Yes.
drinkable skin defense, and thank you for bringing us a sample. I just want us to do a quick cheers.
Of course.
I want to talk about it a little bit more so the
Yes.
listeners can.
So, cheers.
Cheers. I put a little vodka in it, but
I'm sure
If you could give us a quick genesis on the product, where to find the product,
Yeah,
and what it's
absolutely.
all about.
So yeah, thank you for having it on. This is a cool one. We actually
Tastes really good, by the way.
Thank you very much. This was in the gift bags over at your guys' office grand opening, which was great.
Yes.
This was something that we pioneered back when I was at Harvard, and this was a collaborative research study with Harvard and Stanford. What we ended up discovering is there is a plant extract that is in here, and we use this as a supplement that essentially provides sun protection, almost like an SPF. It prevents sunburns and sun damage as a drinkable supplement. Now, the coolest part about it is it's literally a powder. So I put it into my matcha, I put it into my coffee, whatever it is. I take it in the morning, and you're actually protected for the whole day, which is pretty incredible. Now, it's not a replacement for sunscreen. Nothing ever will be, and there are many different reasons for that. But I think the bigger issue is, even as a dermatologist, I'm not reapplying sunscreen multiple times a day. Days get busy, you're working like crazy, you forget. And the reality is most people don't even wear sunscreen in the first place. Nobody really cares that much. But if you can add this into a supplement that's part of your daily routine, it's tremendous. The other thing that I will say on here, especially for our skin cancer patients and patients that are recovering from other scars, from other surgeries, this also will help to prevent future skin cancers. This was a randomized controlled trial, New England Journal of Medicine, phase 3 clinical trial, where we found one of the other ingredients in here, nicotinamide, which is a vitamin B3 derivative. So it's a vitamin-based supplement on there, prevents 1 in 3 skin cancers from forming. So not only are you protected from sun damage real time, whether you're on the beach over here in Miami or enjoying a day out here in the area, or if you have skin cancers that you're concerned for forming in the future, it's a home run.
That's awesome.
So, but yeah, you can find it online. Just search for sun powder. It's on Amazon. It's on our website and everything. And yeah.
For the listeners, it tastes really good, by the way.
You guys like it?
It's a great adjunct to patients that say they don't have the time, right? Or anybody that works outside and puts on that sunscreen, you want extra boost.
Correct.
Right?
Well, time is our greatest asset. And if you can protect your time in the future and maximize your time currently,
And protecting your skin so you can look younger. Right?
that's right.
That's right. All right. Well, with that being said, thank you so much, Dr. Abrouk, for being on the podcast today and all our teammates here. And I hope you enjoyed this podcast. If you have any questions, please reach out. Again, Dr. Michael Abrouk, he's based out of Coral Gables. You can reach out to him and also look into that amazing product, which it tastes amazing for sun powder. Hope you guys have a great day.
we were not sponsored by it. So
No,
we're just giving
it really is.
if they want to sponsor us,
I got to keep your skin healthy out there too. You guys are keeping my smile gorgeous. I've got to keep your skin looking good too.
Thank you so much.
thank you so much, man. Appreciate it.
Thank you, guys.
Thank you.
Thank you.